I'm Dr. Peter Richard Kisenge, intervention cardiologist, and current I'm Executive Director, Jakaya Kikwete Cardiac Institute in Tanzania. So Jakaya Kikwete Cardiac Institute is an institute which is owned by Tanzanian government. It was established in 2015 on September. The institute started with almost 103 beds with ultra-modern equipment. We have ICU for cardiac surgery. We have also coronary care units. When we started, we had 6 beds in coronary care units. And when we started, we had almost 100 employees. But later we increased. Now we almost have 240 employees who are working in this center. So we started this institute, but that time we didn't manage to do a lot of procedure. At that time, we were doing only procedure in cath lab and open heart surgery, mainly for adults. And we had 2 doctors, pediatric cardiac surgeon. One doctor who joined us from Bugando Hospital, Dr. Godwin, who was a pediatric cardiac surgeon. So when we started 2015, we didn't have enough human resource in terms of doctors who will be able to do procedure in cath lab, and doctor will be able to do procedure in surgery. So thank God that we had this charitable organization, Muntada, which was based in the UK. They came to us in 2015. They came for 2 aims. First is to help a patient with who need a life-saving operation, because this patient most of the time Tanzania country, we are taking this patient to India for surgery, and one surgery for a patient, by that time it was about almost 20 million Tanzania shillings, which is equivalent to almost 10,000 US dollars. And most of our patients, they couldn't manage to go to India because of the poor socio-economic status. So we thank God that we got this charitable organization, Muntada. They came to us. They helped. They did. By that time, they did almost 64 operations in 2064, and most of the patients recovered very well. We didn't have any death, as far as I remember. And we started capacity building for our local people. We started with pediatric cardiology interventions and pediatric cardiac surgeons. So they came again in 2016. They did almost 73 patients and with 0 mortality. And 2017 also they did almost 92 cases. In 2018 they did 73 cases. So total up to now they've done almost 352. And this year they've started 1 week ago. They are going to do almost 60 patients and probably even above those patients. So the institute, we managed to build our capacity from our Muntada group. So most of the doctors by that time in 2015, they were not able to do procedures. But in serious, when they came in every year from 2015 up to now, our local surgeons, they are able to do procedure. For instance, in pediatric, we have 2 pediatric intervention cardiologists who are local. They can do most of the procedure like PDA device, VACD, and the ACD device they can do. They also do some diagnostic procedure in pediatric for right and left cut they can do. So acquire a lot of knowledge from our colleague from Muntada. I would like to take this opportunity to thank them very much for helping us to build capacity. But again, apart from building capacity, they also help us, our patients, because these are the patients who probably they could die prematurely because of they couldn't get these interventions. So we also take this opportunity to thank because of saving our life. But again, the institute also, as we manage also to sustain our vision, because our vision is to become an accredited cardiovascular center in the management of cardiovascular disease. So now this institute is a high volume center in East Africa, and probably will be high volume in terms of our quality of doing the surgery even in Africa. And a lot of inputs we receive from our friends from Muntada. So now we have a local doctor who can do surgery. We like now, because instead of them to bring the doctors here, so we want them to bring maybe consumables so that our local doctor can do more. And as you know, a lot of African people, they don't. In African country, there are very few centers, maybe I don't think more than 10 centers they can do with kind of operations like we are doing here in intervention, in cath lab, and the open heart surgery. So the demand is very high, and we want to save poor children who are having this life-threatening problem to come here in Tanzania to get operations so that we can save the life. So I think we should continue this collaboration with our Muntada for them to bring also some consumable, and continues, of course, building capacity in case for complex procedure. We will grow in that aspect. My dad was a doctor, so I used to see him helping patients. Then when I saw him was busy helping patients, take care of people, life, and those kind of things, and then that's I admired a lot. And then I when I was in primary school or secondary school, I said, if God wish, I will become a doctor. So what drives me is I want to help sick people. So the major challenge, as you know, Tanzania is continue to develop in terms of socio-economical, and we are now seeing increase of prevalence of cardiovascular disease. So we need to bring a lot of awareness. There are a lot of patients in periphery, they don't know even the kind of service we are providing here. We need to go there and to screen a lot of patients so that we get this patient, because some of the patients, they have this like PDA problem or VSDS, they are not aware with their problem. So we need to reach them and to screen them so that we can bring them here for operation. So one of the challenges is we need to get some, because everything is about fund. If we don't have fund to reach them is the problem. The other challenge is sustainable, to get sustainable consumable. We are only one center here in Tanzania, and most of the people who are selling this consumable, they are selling very high price because they don't have many centers like this. So we are purchasing in a high price, and then we do few cases. If we could get support from that area to get some consumable in our center, that will help a lot to. And then again, still we need more capacity building. Tanzania, for example, we have more than 66 million people. We have more than 66 million people, and these people, if you take one patient in 100, one is having congenital disease. So you can just imagine how many patients they want this kind of intervention, they don't get. So let me first, once again, give my appreciation, a word of appreciation to Muntada for helping people of Tanzania, for helping kids who really need to survive. Yeah, so I would like to thank you very much for this, and I want the collaboration to continue because the demand is very high. There are a lot of kids who need to get this service in our center, so we wish if they can continue helping us in terms of capacity building and also in terms of resource, like getting some consumable to our center so that we can provide service to many sick Tanzanians who will require this kind of interventions.